Hi, I'm Shockley with Thrive Christian Counseling. This is Owen with the Owen Clinic. And today we're going to talk about foggy brain, post-COVID funk, or depression. We don't know a lot about what COVID has done to all of us if we have had COVID, as well as those who haven't, because we've all gone through the pandemic together. But with the effects of COVID on our brains, it's sometimes hard to figure out, is this just post-COVID funk, or is it really, I'm depressed, I have a clinical imbalance, what is happening here? So we just want to talk to you a little bit about our experience, obviously, as therapists with our clients who come in, and trying to figure out how our brains and our bodies are manifesting the virus, as well as everything we've gone through societally. And what do we do about it?
That's a great question. And to be honest, I don't really know. Whenever we're meeting with patients or clients, we're trying to figure out what diagnostically is going on. And there's so much unknown about what we're hearing, as far as, why am I tired all the time? I'm hazy, foggy-minded. And those are words that have come up in a lot of sessions. Because we don't know, we start kind of dissecting what's the symptom or the behavior that we're hearing that's causing problems, and try to figure out what the response is. So what's the response to post-COVID funk? I don't know. What's the response to being foggy-minded? Well, that's something different. I could look at that and start trying to intentionally force myself to engage. If I were sick and I had to spend time in a bed, I would have to rehab my body. Well, now I need to start rehabbing my mind, because if I just do what I feel like doing, it's not gonna be that much.
Yeah, and there's a lot of clients I have gone to their general practitioners or to their functional medicine doctors and started doing infusions as well, in conjunction with therapy.
Living through pharmaceuticals is fantastic.
Absolutely. If we can treat those parts at the same time, then there's a greater efficacy rate. And so getting outside, I think, is a huge, part of the foggy brain and just not feeling right. I've heard that a lot. I just don't feel right. Getting outside and engaging, like you said, Kevin, I think is, even if we don't feel like it, that we should be doing that. And even having a place where we can talk through that, and how does that make us feel, and how can we be held accountable to certain things, is, I think, important in rehabbing our brains back to even better than they were before.
When you do something intentionally, it does seem to go better. The frustrating part about counseling is I talk to doctor friends, and they love the fact that so much of what they do is measurable. We do what they call soft science, which means that we have to factor for a very fluid thing, because you as a person, well, you're weird. You keep changing, you keep growing, you keep adjusting, and a lot of variables change all the time. And so you want to pay attention to, what am I doing that's working? What am I doing that's not working? What do I need to adjust? Because what isn't an option is just look at it and go, well, I guess I'm just down all the time. No, you don't have to be. And this may be more work than anything that we're familiar with, because, well, we're still figuring this stuff out. But work the process and look at what's going on. If I were to tell you it's November, it's getting darker earlier, I'm more tired than I was, and I'm carrying symptoms of depression, well, we know how to treat seasonal affective disorder. We know how to, well, because we've seen it and we know what we're doing. And sometimes some of this sounds kind of like that, so there might be some information in there, but we can look at it and try to react to what are we seeing, and what do we associate it to, and how do we react.
Absolutely. And I think talking to somebody obviously is the first step. I know a lot of clients who have struggled with it for the last 2 years and who haven't talked to anybody until they're sitting in my office. And I think that is one, it did not cause it, but it is definitely corollary to how they feel and their depression, and whether it's depression or the funk of, just COVID and foggy brain, inability to focus on things more.
Energy level.
Energy level is a big one. Just not having a lot of joy in the things that they used to have joy in. I have a lot of clients who post-COVID have said, I just don't find joy in things that I used to. And so figuring out what things used to bring joy, and then doing them.
I bought a car that I should not have bought recently. It's a Camaro, and it's got a 460 horsepower. And as I push the gas, you can see the gas tank going down. It's fantastic. That thing can go. But in my other car, my grown-up car, if you push the gas tank doesn't move at all. If your gas tank is going down faster, you need to fill up the car faster. If your energy level, your drive, your motivation, your foggy brain, all of that stuff, if you see those levels dropping faster, well, you're gonna have to fill it up faster. Look at those places. What's the response if I'm feeling tired? Well, I'm gonna need to rest more. I'm gonna need to maybe go to bed differently, maybe do different types of caffeine interaction, whatever it is. If your tank's going down faster, fill it up faster. Maybe I need to go to counseling more than I was because I'm aware of the fact that I don't have anything left after the end of the week. Well, that's a problem.
So if you do need to talk to anybody about this, you can call the Owen Clinic or Thrive Christian Counseling.